This one's on you, blah, blah, blah.
For January, it's actually a really nice day. We just threw on our hoodies and we decided to play a game of football. Nothing too serious. We always play tackle, but no one ever got hurt, so we didn't think anything of it.
Mitch Lovett, his pal Terrence Shelby, and some of their Dakota High teammates were playing after class on the field behind the school when Mitch attempted a tackle he'll never forget.
I literally dove for the kid to take his legs out. So as I was coming down toward the ground, the back of his heel just came up to my nose and knocked my head back, and that's when I just heard a loud pop, and I knew right away something was wrong. I got dizzy for a while, so I couldn't see, and when I finally was able to clear the water out of my eyes, I looked down and I just saw a puddle of blood.
I was at work, and one of my coworkers said, "Mitch, he's on the phone. It's, he said it's an emergency." So I picked it up, and he's like, "Mom, you need to get here."
I just kept telling her she needed to get here, and she kept asking me why, but for whatever reason, I couldn't tell her.
I pull up, and he comes walking toward me. I'm like, oh my God, because his nose was like pointing, the opposite, like toward his ear. I'm like, this is not good.
She took him down to the local hospital, and they treated him kind of like it was just a normal break, and that's when she called my father-in-law.
Mrs. Lovett's dad works as a security officer at Children's Hospital.
He actually went up to plastic surgery, let him know, my grandson was hurt pretty bad, he needs to be seen.
Mitch was seen by the chief of plastic surgery at Children's, Dr. Arlene Roselle.
When we first saw him on physical examination, he had a severe injury to his nose with a severe deviation of the nose.
She told me that basically his whole nose was just shattered. There was, like I said, it was like equivalent to an 80-mile-an-hour car wreck impact. That's how bad it was.
Here is how he appeared when he came in the office that day. You can see that his nose is severely deviated over to the left side.
She's like, I want him in CAT scan now. I was amazed. I was like, wow. These people are really on the ball here. So I felt like he was in really good hands.
This is the three-dimensional CAT scan that was done on him. And you see a soft tissue rendition, which is interesting, showing the deviation. And then this is the three-dimensional reconstruction, and you can see that the nasal bones are crushed and pushed off to the side here.
The bones in Mitch's nose had been shattered into multiple fragments, which complicated the surgery.
It's very important to mold all of the fragments back into position the best you can, and then you have to supply support from inside the nose and outside the nose to hold everything in position while it's healing.
She really put us at ease. She said, everything went really well, and just as long as as well as it could be expected, maybe even better. Just have to wait and see.
With an injury this significant, you have to warn the patient that it's possible they may need further surgery down the line, especially in a growing child, because as growth occurs, there may be some further growth disturbance or deviation that you may have to address down the line with more surgery.
I can't say enough about that surgeon. She was fantastic. She kept everybody in the family totally informed, and great experience, really.
For Mitch, the experience was mostly painful.
They kept putting me on morphine because the pain was so bad, and they had me stay overnight.
And he went home with lots of instructions from Dr. Roselle. Because any pressure on the nose could undo her delicate work, he would have to sleep sitting up for the next several weeks right here on the chaise lounge in the living room.
We built a little fort. We had pillows so he couldn't move, and we took the blanket and kind of like tucked it underneath, so he just was kind of like stuck there, and that's how we slept. That's where he sat all day with the remote, and
For about 5 weeks, Mitch's younger sister Leah picked up his homework, changed his dressings, and irrigated his nasal passages. And every couple of weeks, there were visits with Dr. Roselle at Children's.
Several weeks after surgery, the packing and the splint had been removed, and overall, I was pleased with the result. The nose was straight.
I was like, wow. I mean, it was still swollen and stuff like that, but it was straight. I was like, wow.
There would be no need for more surgery, but there were still lots of restrictions.
No running, no lifting, no, you can't do gym class, you can't do any contact sports, you can't do, anything at all. you know, for like 2 months. So.
And his first day back in school was a bitter disappointment when Mitch looked at the football team's depth chart.
And I saw that I was 4th string on the list, and that crushed me because I had expected to be 1 or 2, and to see yourself as 4 obviously is a blow.
Today, Mitch is a freshman at Saginaw Valley University and headed for sports medicine. His girlfriend, Amanda Potter, from back at Dakota High, is also enrolled. Actually, they had broken up way back before his injury, but a lot of things have changed since then.
Maybe it was the nose or something that won her over again, but we ended up back together.
As for the football team back at Dakota, once his nose had fully healed, Mitch put in long, grueling hours of training and practice over the summer months and finally won the starting quarterback job. Oh, and the team went undefeated and won the state championship.
You know, week after week, we just kept going out and winning ball games, and I just kept getting better and better, and next thing you know, you're winning a state championship, and it's basically just the perfect way to end a story that you never thought would happen.